Now to more on COVID-19. New this morning, there are now more than 25 million confirmed cases around the world. This morning, Johns Hopkins University is reporting that more than 842,000 people have died of COVID-19. The U.S. still has the most infections in the world, with nearly 6 million cases. A top ER doctor in New York, which, as you know, once the epicenter of the outbreak, is now fully recovered from COVID-19, or is he? We're still learning how it plays out. He is sharing his experience with the disease, with the virus, and clearing up confusion about it. Dr. DrJakeDeutsch, co-founder and clinical director of Urgent Care Centers, joins me now. And an ER doctor, as I mentioned. Doctor, good to see you. You contracted this virus in March, when we really didn't know much about it, right?
That's correct. So we were seeing patients before there was the recommendation to be wearing face masks, and we were treating people who had flu-like symptoms, who had negative flu tests. And I remember, having conversations. Do you think that this is that virus that everybody's talking about? And I honestly, looked at several patients and said, we don't know. But they're telling us it's just going to be like a flu. There's probably not going to be that much ramification from what they're predicting. So, we'll figure it out. And sure enough, a couple of weeks later, early in March, I ended up getting very sick, was able to get tested relatively quickly, which wasn't easy at that time, and found out that I was positive. So, I anticipated it to be flu-like, like everybody had said, maybe 7 days. 1 week, I realized something wasn't right. I ended up checking myself into the ER at Mount Sinai, where I have privileges, and sort of became the patient, not the doctor, and had an X-ray, which immediately when they did it at the bedside, I said, wow, I have pneumonia. It looks like I'm on both sides. So, that was really an eye-opening moment, and certainly personally, professionally, to be a patient with something that was really unknown. And luckily, my oxygen was not too low. I was able to go home and treat myself, and made full recovery.
Because our own Chris Cuomo says, look, he is still feeling it. His lungs aren't at 100%, and that the unknown to him adds to the stress of the unknown in terms of COVID-19.
Yeah, I really can say that I am at 100%. There was several weeks before I really felt energy to things like working out and getting back to my normal. I'm a very healthy person. But, I've heard from a lot of patients that they do feel some lingering residual symptoms, whether it's some shortness of breath or some fatigue that lasts longer. We don't know really what the long-term implications of this virus are. Luckily, most people have a full recovery. And while we don't have a clear picture of what to be worried about, we're following this very closely, and I'm just cautious that people don't use it as a crutch to say, oh, I have a chronic situation, because stress is a factor, or because the unknown is a factor. It's important that people follow up with if they have ongoing symptoms after the expected time frame.
And being an ER physician, how is New York doing? Because we were all watching Governor Cuomo as he was giving those PowerPoints in terms of what to do and the numbers and being matter of fact. How are they doing in New York in terms of the numbers?
Susan, we've come a long way. I mean, I couldn't be more proud to be a New Yorker, to be a physician. We came together as a community like I don't think I've ever experienced. We're doing much better. Our testing is less than 1%, below the national average. We have capacity to treat people. We really rallied because New Yorkers are really so close to one another. The proximity, the physical distance, we could hear the people clapping every night at 7 o'clock. There really was an incredible sense of camaraderie, and we're really doing great. And I give testament to everybody working hard to, wearing masks, social distancing. That really has proven to be effective for us in our city.
Yeah, good advice that we've been repeating over and over. Doctor, thank you, and I'm glad you're doing better after recovering from the virus.
Thank you.